my name is Christina Igasto, and my role is Chief Digital Health Officer and CIO of Western Sydney Local Health District. About Western Sydney Local Health District, we're clinical leaders in research and education and provide public health services across 120 suburbs. There is 1 million people in the catchment, and we are the fastest growing region in the state. Patient journey for us is really important, and patient experience is of particular importance. Right now, we're working through what does that look like to be digital enabled in the context. This involves a couple of different things: the patient engagement. How do we then support digitally appointment registrations and perhaps referrals that comes? What does that mean then from a check-in, check-out perspective? Visitor management, how do we then support and make a good experience for our patients when they visit our facilities? That includes the queue management and the waiting times. And it also includes then, of course, if you can implement wayfinding outside and inside our hospitals and guide our patients through our facilities by, have a digital directory or other, components that can support in that navigation. So the end-to-end patient journey and having that digital enabled is our vision. Visitor management in a hospital setting involves a couple of different practices to be able to manage your visitors and to create a good experience for our visitors. So to be able to say who and when who visit our different facilities. And in case of, as it's been the last couple of years, that we need to do certain screenings before our visitors enters into the hospital, it's been also then important to have that visitor management for registration and be able to ask a couple of questions for screening purposes. I think it's three things that's particularly appealing with the DH5 framework. And one is the extensibility, that you can expand on the platform and build out, realize other use cases as functionality that you might not have thought about at the first instance. I think the scalability is another attractive feature of the DX5 platform, but also a usability. And that's the usability for the patients when they come in and they scan the QR code that they use and they get the questions up and they answer all the questions, but also the usability for the staff or the admin side of the questions. It's easy to customize, change the questions, move them around. It's very, very flexible in that way. So the multilingual capabilities that the solution has is we have translated into 13 different languages, which then support the equity of the Western Sydney demographic community to enter into our facilities so they can easier interact with the questions and answer in their preferred language. So what has changed in the district since adopting this solution? It's a couple of different things. First of all, it's not as resource intense as it was before. But I think more important is the whole visitor experience. It's a completely different experience for the visitors. Today, they don't need to repeat if they've already been a visitor before. Data that's related to their as a patient. What am I most proud of? I'm probably most proud of the multidisciplinary team, how the digital health solution team, together with the 5 Faces team and the clinical workforce, worked as a joint team to be able to resolve all the issues. I'm very proud of how fast we rolled out the solution. I think it was only 2 weeks, and it was a lot of additional requirements and questions and even new functions that was not expected, as we just talked about, that could then resolve quickly together. And then, the team just came together to do that. The experience of working with 5 Faces has been great. I think it's been a cordial relationship, solution-oriented. As I said, it's a joint team that we've been working together. The team has been amazing from all the different, whatever teams you belong to, been working collaboratively to achieve the objectives. For every digital project out there, work together as a multidisciplinary team with the industry, your own IT or digital health team, and the clinical workforce, and then you achieve greater outcome.